So I'm not going into the details of Onno's, and Onno will specifically talk about the work of Esther Dulfo, and of course we are all very eager to hear about this. And we all know Onno already from his inspiring and enthusiastic talks, and Onno is continuously always thinking about new concepts and additions to the family. But what maybe is nice to say, why I think that the whole thing flourished as it did, that altogether we sort of found a fit with each other, with Kees, with Onno, with George, with Max, with Joop, with Jacqueline, with many people around it, and therefore I think the human touch on this kind of constructions may be crucial. And like us civil servants, often we don't think so much like that, but Kees is always saying, well, in private sector, it's all about the personal fit that you find with each other. And I think that has been quite crucial. And with Onno, not in the least also.
No, he's a horrible man, but...
Exactly. But we found each other.
We found each other,
yeah.
And we found a way to like him, right?
Yeah.
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 But anyway...
No, but
thank you.
Yeah.
So now you...
Okay, we... 15 minutes.
15, yes.
Schellekens.
10.
Okay.
So, no, I'll try to say something about Esther Dulfo, because basically, I don't know whether this is going to work properly. Yeah, because for this reason, mainly, she is apparently, according to The Economist and many others, on the top one place for the next 5 to 10 years to win a Nobel Prize. And I think it's really interesting to see what kind of information or what kind of concepts she has developed. And also, in my opinion, but I'm not how to say that, maybe the appropriate person to say that, but in the field of development economics, I think there are many, many, many things that could get more attention if we look to how we got rich ourselves in our part of the world, and to make that link to development. And she's at least addressing it, but there are some other people that I try to at least touch on who have won, I think, 4 to 5 Nobel Prizes in the last 20 years, but that have not been really incorporated, as far as I know, but probably some people get upset, in the development economics of today. So what are her observations? And I think it's really quite staggering. She's at MIT. She just wrote this book that we all can understand, at least I could understand, and I think we all can. It's a simple summary of what you see when people live at the bottom of the pyramid. Half of the world population, or maybe more, live for a couple of dollars a day. And this is her background. The book is called Poor Economics. And, well, I have some summary here. First of all, she says, you know, we do not know what works. So I just give you an example of what she tries to do, and what is her name to fame. She is basically copying clinical trials in the medical science in economics. So I take a school in Kenya, and I have a problem with the uptake of kids, and then how do I get the school, how do I get the attendance of the kids up? Can I do that best by motivating the teacher, the kid, or the parents? And then she does that at multiple sites, and then you get a conclusion, and then you have the absolute truth that there is this elasticity, and that with this you can realize this. And that is something what she has done, I think, quite brilliantly, and I think it's her name to fame. She's doing that on many places, and based on this knowledge, this understanding, this insight, this philosophy, she has produced this book, and there are some staggering facts in there. And up to today, and that's why I raised that question this morning, that's why the Medical Credit Fund can be a success, but many other things as well. Many of the things are neglected, in my opinion, by policymakers, by social investment banks, and also by development economists. First of all, this, I think, is a very good example. She has done a trial with fertilizers in Kenya. So if I give farmers in Kenya living on $2–3 a day, if I give them fertilizer, And they know they are educated that they will make a return of, let's say, 60% in 6 months with an investment of 5%, then it turns out that only 40% of the farmers is doing this and 60% is not. And she published this, and it's quite a well-known study. And The Economist wrote then, I think 1.5 years ago, finally it has been proven that the Homo economicus doesn't exist at the bottom of the pyramid. Whole article. And another, so the willingness to invest for people at the bottom of the pyramid, this study shows, is very low. Another one is, we have had some arguments, I've had also, and Max and others, on the interest rates. Sweden raised it this morning, and then Mr. Beck, Professor Beck, showed what the interest rates are in Kenya. But he doesn't say, and we have been discussing it, and he's the first to admit, is that the percentages that people pay, the 85% that is not AAA rated, is according to, and this is literally from her book, it is 40 to 200%. This is a literal quote. It's not my opinion. It's not an overstatement. It's straight out of the book. And that is not being measured. So one of the things we want to do in the next phase, in the next things, maybe with help also of the ministry, is to measure this level of uncertainty. And we want to spend more time and effort why this is happening. So the next thing she spent some time on, which is also, I think, something that we all know, is this picture. It's from my colleague Christine. She's doing a PhD, and you cannot see it, but I stole it from her, and I had to say that this was her property, and it belonged to her PhD study. And so, Christine, everybody knows. But this is a very good picture because it shows that the poor, they have 3 jobs at the same time. So they sell some stuff, they have a barber, they do some hair cutting, and they maybe do some other stuff in this case. But it shows that they diversify their risks. They do not know whether tomorrow there will be somebody coming for a haircut, so they will do something with drinks or anything like that. It's an indication of the shortage of working capital, I think. A very small, no scale at all. So, in conclusion on Esther Dulfo, basically what she did, and she for this work, it's a little bit more, but not much more, she has gathered information on the behavior of people at the bottom of the pyramid. And for things that we do here every day, where we study every day the behavior of people in the OECD countries, for that she's going to win a Nobel Prize. And I think that's very important for us to realize that this is the world that we're living in. So her conclusions, very, very briefly summarized, is that people at the bottom of the pyramid, they don't have safety nets, they don't have any trust, it's very costly at the bottom of the pyramid to do transactions, and the most important problem, the most obvious problem, is the high cost of capital. She does not spend time on this whole thing, the influence of new institutional economics, the school of thought that has developed in the last 20 years. And that I want to spend some time and share with you in the next few slides on what it learns. This one is a little bit difficult, but then the next one is a practical example of what this guy is saying. This guy, one of the founders of this new institutional economics, is a person called Douglas North. Basically what he says is that here in the world we live today, in the OECD countries, we are living under the so-called new classical economic theories. So we don't realize really what it brings in our daily transactions. When we do exchange, when we buy something, when we invest, what it means to be in OECD countries. Just an example. When you look to eBay, today you can buy here in Chile a bottle of whatever wine, without knowing that person. You can buy it directly. You don't know that person. but the transaction is structured in such a way that you will not be cheated. Because there is an enforcement system, there is payment systems, there is transparency of what you buy, and we are living under conditions of what is called impersonal exchange. This is happening for eBay, but it's also on the stock exchanges. In many cases, this is happening. Basically, what we're saying is that we are living under circumstances where the rule of the game is determined by an independent entity and they make it efficient. What happens when that is not the case? I just give you an example. If as a bank you're financing a house in the Netherlands, you charge on average 5 to 6%. So let's say you have a loan of 200,000, it's a 10-year mortgage, so you pay 100,000 interest. If you do the same thing in Kenya, where there is no enforcement and there is no trust and there is no institutions that make you as a bank feel comfortable with the setting for a 10-year loan, then you charge 40%. And, for example, and the interest rate is 800,000. This means there is, in Kenya, for one house, 700,000 waste, inefficiently spent money. It means that people cannot afford to take risk. It means that they cannot invest. It means that the opportunity cost for them are completely out of whack when you compare it with us. And I think this point has not been acknowledged enough in the development literature, according to me. So this is a study. Tine is already gone, but this is done by one of her colleagues, Jan Luijten van Santen. I think it's you start to laugh. Maybe it's your study. Okay, I got it from the book. Jan Luijten van Santen. He won the Spinoza Prize, the Dutch Spinoza Prize, for taking one step further the philosophy of Douglas North. That institutions matter. They make it efficient. If you have good trust and enforcement, the cost of capital goes down. But if not, then you have the opposite. And then you have high cost of capital. And this slide shows how this is done, what the effect is in England. And the same is true for the Netherlands, and the same is true for Japan. So this point is, I think, a very important point for us to take into account from a development perspective. I don't know how to do what to do, but the fact is important, I think, to at least take into consideration. Here, Torsten Beck showed this morning the slide of 14% interest rate in Kenya. This is a slide from the World Bank, and it shows that sub-Saharan Africa is running at 20%. But again, as I said, this is only for formal contracts. Yeah, the official base contracts. The 60 to 80% that is going informal is not included in these slides. All the policies are based on, the discussions are based on different figures. So what does it mean? What does this mean for health? It means that if I'm trying to bring insurance to poor people, that the first thing that they have in doubt is when I do a prepayment, will I get a benefit? They don't have any trust that if they pay today, that 10 months from now, the thing will still be there. So that's one thing. The second thing that we should take into account that is because there is no enforcement there is a lack of standards and data, you don't know what risk you're taking. At the same time, there's also very limited trust, so you cannot do this thing of impersonal exchange. No, you're limited to the group that you're part with, that you are a part of. You cannot go beyond that because you don't know what to do in case of a problem. And this results also in a very low risk appetite for investors, both as a consumer and as a risk taker to invest in capital assets. It means that you have very high discount rates and high cost of capital. What does it mean? What does this mean then? What implications does it have for healthcare in Africa? Well, you see this. This is, I think, one of those staggering slides, and it's not criticism on the IFC. I want to say that once and again. the IFC is the investment arm of the World Bank. It is true for all development banks. If you look, for example, but they are publishing it, and therefore we can present the data. But it's not a criticism, because there's all kind of market failures and public interventions that make these data like it is. But the fact is still important. In 10 years' time, 1997, 2007, the World Bank spent 12.8 billion on healthcare. And out of that 12.8 billion for healthcare, where 50% of all the care is provided by the private sector, $12 million ended up in Africa. This is a fact. And I think that if you have these kind of data, then of course it is not strange that something like health insurance basically doesn't exist. Because why should I prepay for a scheme when I'm already so poor that I do not know whether there's any medication or a doctor in a clinic with any working equipment? And that is the background of this slide that we have discussed before. Because that is the case, there is no willingness to prepay. If there's no willingness to prepay, there's no money in the system. If there's no money in the system, nobody is willing to prepay. And that has been the starting point for, I think, also the people from the IFC and the World Bank. There has been a huge change lately in thinking. 5, 6, 7 years ago, it was not possible to talk about mixing of public and private on health. I think it was really very, very difficult. Based on this analysis, we have tried to work on a new development paradigm. These are the 3 assumptions that I don't want to go into details here, but basically what we're saying is, let's try to contract directly private insurance company and channel public money through it, and then you'll see that willingness to prepay goes up and that investors will be willing to invest. And the results are like this. Just give you some brief slides on Nigeria. It's a 5-year commitment of 25 million. And we have today spent 10, it's slightly more, but this is a couple of months ago, 10 million euros. 70,000 farmers and 8 million spent on this group of people. The farmers have started to prepay in the market women, and there has been some margin for on the supply side by the HMO, by the insurance company. And now, 4 years later, $30 million, Vola was saying it was even more, has been invested in this system. Conclusion, long-term donor commitments, if you do it right, in our opinion, the renewal rate can go up to very substantial amounts, much higher than the 40% of what the farmer is getting for his fertilizer in 6 months. So I think that's a very important thing to consider. The person can decide to spend the money on fertilizer or on health insurance, and our renewal rates are better than this. So we are doing something right. The cost of debt on the supply side reduced with 40%. And today, 2.5 times more capital has been made available in this system than what has been invested by the social investment banks in 10 years' time in the whole continent. That has changed lately, in the last 2-3 years, because they all know that this is not possible, but still it is for the period 1997-2007 true, and the total amount of money in the system went up 4 times. Overall conclusion, I believe, and we should pay more attention to that, if trust is there, things can be changed and it can be done. And it really requires very difficult public and private collaboration models. And the last is a real, this is a lecture, otherwise I would have said something emotional. But I think we need instead of a capital asset pricing model that received 4 Nobel Prizes, it has a neoclassical theory for capital asset pricing. We need a development asset pricing model. Thank you very much.